And now we're going to go to a series of toasts. And the first person to give a toast is somebody who knows Dr. Young very well, his daughter, Polly Young. Polly is a physician in the San Francisco Bay Area. Dr. Young, the other Dr. Young, the young Dr. Young.
Thank you. Thank you very much. Well, there are actually, I don't know how many of you know that, who know Quentin as an activist, know that he is actually a paterfamilias and has 5 children, 13 grandchildren, and 5 of his kids here, and as Ethan are here tonight, and as Ethan said, 5 of his grandchildren have come from across the country to honor him tonight, and we're delighted to be here with you. Decades ago, Quentin was a single father with shared custody of us 5 kids, long before this was a commonplace arrangement. In fact, he was the first, I think, in the state to have shared custody. This is a commonplace thing today, but back then it was quite unusual. I just want to say that home life was a far cry from Father Knows Best back then. There were Sunday mornings trailing Dad on hospital rounds at Michael Reese Hospital, as he showed in the video. And there were evenings spent on the sidelines at political meetings, often while doing our homework. You all know, you who know Dad know what a busy guy he always has been and still is. All of us kids put in time waiting for him to arrive, and even more time trying to leave with Quentin as he said the long goodbye to all assembled. I'm sure any of you who are close to him have had that experience. And you can imagine the humiliation of teenagers who had a father who spent more time on the phone than they did. On the other hand, we enjoyed a childhood like no other. Dad's townhouse on 55th Street was a salon for a never-ending parade of medical students, neighborhood activists, and lefty politicos of all stripes, and of course the occasional police agent. Hugh Hefner may have held court in his silk pajamas, but late-night bull sessions were presided over by Quentin in his underwear. I think he was usually dressed for Sunday brunch, an informal affair with bagels and lox, attended by an ever-changing crowd. House guests included an historic array of activists. His house was open to civil rights workers from the South during the height of the civil rights movement. Activists like Stokely Carmichael, Cleve Sellers, Jesse Jackson were all part of the ongoing discourse around the dinner table. We also got to know those who made their bones in the 40s, like Frank Fried and Bill Sennett. I remember meeting heroes like Mrs. Fannie Lou Hamer, Fred Hampton, and Dr. King. As kids, we were privileged to meet and talk with giants of the era. I want Ethan to say a few words as well.
Okay, thanks. Growing up with Quentin as a model was not without its pitfalls. We had to come to assume that political activism and morality were a part of a package deal. Not in the sense of political correctness, always saying the right thing and keeping things sensitive. We just took it for granted that if you worked for justice, that meant you didn't enhance your position with political favors or use connections for personal enrichment. Imagine our surprise. Tonight, it's worth recalling that Quentin never worked alone. He has always been part of a broader community of progressive health professionals, organizers, and campaigners. They helped Len Dupre, Bill Cousins, Tim Black, and Harold Washington, and the Old Machine. They took on segregated hospitals, the Vietnam War, and HUAC, and they all deserve tribute for their hard and ultimately successful efforts. Now, when I wrote those words, it somehow didn't occur to me that I was describing y'all. But on behalf of the Youngs, we thank you for getting together to help our dad with his little self-esteem problem. We don't want to leave him with too high an opinion of himself. He still has a long way to go. However, it's worth noting that the total mess that our healthcare system is in today was predicted by Quentin to a T back when the powers that were, we'd like to say the powers that were, powers that be, chose managed care over single payer. This was not a lucky guess. He got it right because he takes the people's side and speaks with the courage of his convictions.
And finally, I just want to say that, as we all know, polls show that a majority of Americans support single payer, and the more the word gets out and the more people actually understand single payer, they're for it. And as Governor Quinn said, may the will of the people be the law of the land.